Pathology of the integumentary system. What are skin pathologies? The pathologies of the integumentary system, or also called skin diseases, are considered to present a wide variety of primary skin diseases as other systemic diseases that manifest through the skin. The skin, like any other organ in our body, is susceptible to different diseases, since it is an area of the body that constantly suffers attacks from pathogens that try to overcome this barrier. In addition, there are different situations in the environment that can cause disorders or conditions to develop in it. Skin diseases, when visible, usually have a significant psychological impact, including frequent skin lesions, such as dermatitis, lichen planus, impetigo, pityriasis, keratosis, skin rash, vitiligo, urticaria, alopecia, rosacea, among others. The video presents some of the most common pathologies in our environment, those that are more frequent in the daily medical consultation.
What are the most frequent causes that favor the development of pathologies? The number of materials or products that cause occupational skin diseases is unlimited. At present, they are classified in the categories of mechanical and physical agents, and their number is increasing from year to year. Mechanical agents, friction, pressure, and other forms of more intense trauma can induce changes that vary between the formation of calluses and vesicles, lacerations, tissue tears or abrasions, which favors the appearance of secondary bacterial infections or, less frequently, fungal. Physical agents: heat, cold, electricity, sunlight, ultraviolet light, laser radiation, and high-energy sources such as X-rays and other radioactive substances are potentially harmful to the skin and the entire body. High humidity and temperature in the workplace or in a tropical work environment can interfere with the sweating mechanism and cause systemic effects, producing rash, dizziness, skin maceration, and favoring bacterial or fungal infections, especially in the diabetic and overweight people. The most frequent skin diseases in our environment are presented below. Psoriasis is a chronic autoimmune condition that causes the rapid buildup of skin cells. This buildup of cells causes scaling on the skin's surface. Inflammation and redness around the scales is fairly common. Typical psoriatic scales are whitish silver and develop in thick, red patches. Sometimes, these patches will crack and bleed. Psoriasis is the result of a sped-up skin production process. Typically, skin cells grow deep in the skin and slowly rise to the surface. Eventually, they fall off. The typical life cycle of a skin cell is 1 month. Corresponding to the histology of psoriasis, it can present with multiple key characteristics within its evolutionary transformation process. Being a disease of autoimmune origin, it presents with an increase in the number of Langerhans cells, plus the presence of edema and inflammation of the dermis, with dilation and tortuosity of the papillary vessels. From a more superficial view, micropsises known as pus pockets can be evidenced, which allows the surface to become irregular. With this, the concentrations of dead tissue or parakeratosis increases considerably. Once all the psoriatic process seen histologically, the desquamation of the skin occurs with the naked eye, which manifests itself with silvery scales with irregular edges, accompanied by erythema. Scales typically develop on joints, such elbows and knees. They may develop anywhere on the body, including the hands, feet, neck, scalp, face. Less common types of psoriasis affect the nails, the mouth, and the area around genitals. According to one study, around 7.4 million Americans have psoriasis. It's commonly associated with several other conditions, including type 2 diabetes, inflammatory bowel disease, heart disease, among others, like psoriatic arthritis, anxiety, depression. Symptoms. The symptoms of psoriasis vary depending on the type you have. Some common symptoms for plaque psoriasis, the most common variety of the condition, include plaques of red skin, often covered with silver-colored scales. These plaques may be itchy and painful, and they sometimes crack and bleed. In severe cases, the plaques will grow and merge, covering large areas. Disorders of the fingernails and toenails, including discoloration and pitting of the nails. The nails may also crumble or detach from the nail bed. Plaques of scales or crust on the scalp. People with psoriasis can also get a type of arthritis called psoriatic arthritis. It causes pain and swelling in the joints. The National Psoriasis Foundation estimates that between 10% to 30% of people with psoriasis also have psoriatic arthritis. Other types of psoriasis include pustular psoriasis, which causes red and scaly skin with tiny pustules on the palms of the hands and soles of the feet. Gutted psoriasis starts in childhood, causes small, red spots on the torso and limbs. Triggers may be respiratory infections, strep throat and tonsillitis. Inverse psoriasis, which makes bright red, shiny lesions that appear in skin folds, such as the armpits and groin. Erythrodermic psoriasis, which causes fiery redness of the skin and shedding of scales in sheets. It's triggered by sunburn, infections, certain medications. What causes psoriasis? No one knows the exact cause of psoriasis, but experts believe that it's a combination of things. Something wrong with the immune system causes inflammation, triggering new skin cells to form too quickly. Normally, skin cells are replaced every 10 to 30 days. With psoriasis, new cells grow every 3 to 4 days. The buildup of old cells being replaced by new ones creates those silver scales. Psoriasis tends to run in families, but it may be skipped generations. For instance, a grandfather and their grandson may be affected, but not the child's mother. Things that can trigger an outbreak of psoriasis include cuts, scrapes, or surgery, emotional stress, strep infections, medications, including blood pressure medications, like beta blockers, hydroxychloroquine, antimalarial medication. Treatment. Some treatments slow the growth of new skin cells, and others relieve itching and dry skin. Your doctor will select a treatment plan that is right for you based on the size of your rash, where it is on your body, your age, your overall health, and other things. Common treatments include steroid creams, moisturizers for dry skin, cold tar, a common treatment for scalp psoriasis available in lotions, creams, foams, shampoos, and bath solutions. Cream or ointment, a strong kind ordered by your doctor. Vitamin D in foods and pills has no effect. Retinoid creams. Treatments for moderate to severe psoriasis include light therapy. A doctor shines ultraviolet light on your skin to slow the growth of skin cells. PUVA is a treatment that combines a medicine called soiling with a special form of ultraviolet light. Methotrexate. This drug can cause bone marrow and liver disease as well as lung problems, so it's only for serious cases. Doctors closely watch patients. You will have to get lab tests, perhaps a chest X-ray, and possibly a liver biopsy. Retinoids. These pills, creams, foams, lotions, and gels are a class of drugs related to vitamin A. Acne, also known as acne vulgaris, is a long-term skin condition that occurs when dead skin cells and oil from the skin clog hair follicles. Typical features of the condition include blackheads or whiteheads, pimples, oily skin, and possible scarring. It primarily affects skin with a relatively high number of oil glands, including the face, upper part of the chest, and back. The resulting appearance can lead to anxiety, reduced self-esteem, and, in extreme cases, depression or thoughts of suicide. Symptoms. Acne signs vary depending on the severity of your condition: whiteheads, closed plugged pores, blackheads, open plugged pores, small red, tender bumps, papules, pimples, pustules, which are papules with pus at their tips, large, solid, painful lumps under the skin, nodules, painful, pus-filled lumps under the skin, cystic lesions. Acne usually appears on the face, forehead, chest, upper back and shoulders. Causes. 4 main factors cause acne: excess oil, sebum, production, hair follicles clogged by oil and dead skin cells, bacteria, inflammation. Acne typically appears on your face, forehead, chest, upper back and shoulders because these areas of skin have the most oil, sebaceous, glands. Hair follicles are connected to oil glands. The follicle wall may bulge and produce a whitehead. Or the plug may be open to the surface, causing a blackhead. A blackhead may look like dirt stuck in pores. But the pore is congested with bacteria and oil, which turns brown when it's exposed to the air. Certain things may trigger or worsen acne. Hormonal changes. Androgens are hormones that increase in boys and girls during puberty and cause the sebaceous glands to enlarge and make more sebum. Certain medications. Examples include drugs containing corticosteroids, testosterone or lithium. Diet. Studies indicate that consuming certain foods, including carbohydrate-rich foods, such as bread and chips, may worsen acne. Stress. Stress doesn't cause acne, but if you have acne already, stress may make it worse. Risk factors for acne include age. People of all ages can get acne, but it's most common in teenagers. Hormonal changes. Such changes are common during puberty or pregnancy. Family history. Genetics plays a role in acne. If both of your parents had acne, you're likely to develop it too. Greasy or oily substances. You may develop acne where your skin comes into contact with oil or oily lotions and creams. Friction or pressure on your skin. This can be caused by items such as telephones, cell phones, helmets, tight collars and backpacks. Treatment. Creams and lotions are best for sensitive skin. Alcohol-based gels dry the skin and are better for oily skin. Remedies may contain the following active ingredients: resorcinol, helps break down blackheads and whiteheads; benzoyl peroxide, kills bacteria, accelerates the replacement of skin. Salicylic acid, assists the breakdown of blackheads and whiteheads and helps reduce inflammation and swelling. Sulfur, exactly how this works is unknown. Retin-A, helps unblock pores through cell turnover. Azelaic acid, strengthens cells that line the follicles.
Ringworm, also known as dermatophytosis, dermatophyte infection, or tinea, is a fungal infection of the skin. Ringworm is a misnomer, since a fungus, not a worm, causes the infection. The lesion caused by this infection resembles a worm in the shape of a ring, hence the name. Ringworm is usually specifically used to describe tinea corporis, ringworm of the body, although it can sometimes be used to describe tinea infection in other locations, such as tinea cruris, ringworm of the groin. Symptoms vary depending on where you're infected. With a skin infection, you may experience the following: red, itchy, or scaly patches, or raised areas of skin called plaques, patches that develop blisters or pustules, patches that may be redder on the outside edges or resemble a ring, patches with edges that are defined and raised. If you're experiencing dermatophytosis in your nails, they may become thicker or discolored, or they may begin to crack. This is called dermatophytic onychomycosis, or tinea unguium. If your scalp is affected, the hair around it may break or fall off, and bald patches may develop. The medical term for this is tinea capitis. Find out more about scalp ringworm and its effects. Different types of fungi cause ringworm. Doctors call ringworm different names depending on where it affects the body. Ringworm of the scalp, tinea capitis, often starts as isolated scaling in the scalp that develops into itchy, scaly bald patches. It's most common among children. Ringworm of the body, tinea corporis, often appears as patches with the characteristic round ring shape. Jock itch, tinea cruris, refers to ringworm infection of the skin around the groin, inner thighs, and buttocks. It's most common in men and adolescent boys. Athlete's foot, tinea pedis, is the common name for ringworm infection of the foot. It's frequently seen in people who go barefoot in public places where the infection can spread, such as locker rooms, showers, and swimming pools. Causes of ringworm. 3 different types of fungi can cause ringworm: Trichophyton, Microsporum, and Epidermophyton. It's possible that these fungi may live for an extended period as spores in soil. Humans and animals can contract ringworm after direct contact with this soil. The infection can also spread through contact with infected animals or humans. The infection is commonly spread among children and by sharing items harboring the fungus. Ringworm treatment. Your doctor may prescribe various medications depending on the severity of your ringworm infection. Jock itch, athlete's foot, and ringworm of the body can all be treated with topical medications, such as antifungal creams, ointments, gels, or sprays. Ringworm of the scalp or nails may require prescription-strength oral medications such as griseofulvin, Grispeg, or terbinafine. Over-the-counter, OTC, medications and antifungal skin creams may be recommended for use as well. These prevention advice often given includes: avoid sharing clothing, sports equipment, towels, or sheets. Wash clothes in hot water with fungicidal soap after suspected exposure to ringworm. Avoid walking barefoot. Instead, wear appropriate protective shoes in locker rooms and sandals at the beach. Avoid touching pits with bald spots, as they are often carriers of the fungus. Vaccination. As of 2016, there is no approved human vaccine against dermatophytosis. For horses, dogs and cats there is an approved inactivated vaccine called Incell dermatophyton that provides time-limited protection against various strains of Trichophyton and Microsporum fungi. With cattle, systemic vaccination has achieved effective ringworm control. Since 1979 a Russian live vaccine, LFT-130, and later a Czechoslovakian live vaccine against bovine ringworm have been used. In Russia, animals such as foxes and rabbits have also been treated with vaccines.